you tend to get insufficient and inappropriate notes when somebody has waited too long to do their documentation. And so when they try to do it without copying and pasting, they will shortcut the note and because they can't remember what happened. I mean, you figure some of these clinicians are seeing six, seven clients a day on an outpatient basis. If you let that go for a few days, I can tell you as a former clinician, it is almost impossible to remember exactly what happened in each session.
Right, and not only that, and sometimes, in all fairness, it's not always the clinician's fault where they, put it off. It may be that their schedule is so jammed with back-to-back clinical sessions that, there's always the balancing act of trying to be a true empathetic listener and focus totally on the client versus trying to take contemporaneous notes at the same time, where you unfortunately may only be half listening if you're also writing your clinical note at the same time. And I can remember, my son who's older now, when he was young, we did some therapy. And I distinctly remember being in on a session and seeing the clinician typing every sentence he gave the answer, she sat there and was typing furiously, and I certainly understand why she was doing it, but it definitely breaks rapport when you're looking down at your computer and trying to, do the check boxes while you're still listening to the individual's issues. So I think there's a balancing back, there's a dichotomy there, and the idea of using something like AI to let a clinician be an active listener and truly be listening and not be worrying about the clinical note that's not getting written. I think I can't overemphasize how huge of a support that can be.